Thank you, Jamie. Welcome to our first restart, if you want to say, of our UMC physician and medical staff chat. We're doing a slightly different format today than we did in the past, and we have Jamie Sherman, who is helping coordinate some of these things for us. We have Dr. Dr. McGoey here, as well as myself as Chief Medical Officer at UMC. We'll try to keep things as brief and concise as possible, as well as provide the information that we said we would. This is going to be occurring every other week on Wednesday, as well as email communication that we're going to be sending out at noon on Thursdays. And so there's going to be, again, a couple of email and Zoom modalities that we're going to be utilizing to ensure we can stay connected with everyone.
So this is Dr. McGoey here. Some information for you on the Q&A portion as we plan it right now on these chats. If you have any questions during the duration of these calls, we encourage you to use the chat function. It's highlighted here on the slide, but it's going to be located in the navigation bar on the bottom of your screen. Answer to these questions that we accumulate during the call will be posted either in Thursday's e-newsletter, emails, and addressed in the next week or next bi-weekly's Zoom chat. One request as it relates to Zoom etiquette, please keep yourself muted during the duration of these particular calls.
So changing gears a little bit and going into the content of our talk today, I want to put out a big congratulations and kudos to the burn team. The American Burn Association has a verification program where hospitals can apply and verify that they are meeting the highest standards for burn injured patients. And this provides a distinction as well as an accolade for hospitals and their burn centers, indicating that they're meeting, again, the highest possible care standards, and as an indicator to government, payers, patients, and their families that we are trying to deliver the best possible care. Dr. Carter and his team have done tremendous work in trying to get this burn center started and ramped up. It's been done in a very short period of time, and we are now the only level one American College of Surgeons accredited level 1 trauma center, as well as ABA verified burn center in the state of Louisiana. So this is an important service we provide to our community and our surrounding region. Also, another shout out for our trauma team. The 2019 George Loker Community Service Award was awarded to the trauma program here at UMC. And this is for the tremendous life-saving work that is being done, where more than 80% of GSWs, gunshot wounds that come into our hospital, have been saved in the last 3 years. And so again, this is tremendous work. Crime Stoppers serves a 9-parish region of southeastern Louisiana and helps foster strong community, safe community work. Their mission is to prevent and solve crime by providing enforced education and crime prevention programs for youths and at-risk individuals, and by assisting law enforcement agencies, victims of crime and their family, and in identifying and arresting criminal suspects. So this is a prestigious award, and we are proud of our team that has led this effort. So thanks to the UMC trauma team, Dr. Hunt, Dr. Duchesne, and all the other trauma surgeons that participate in this critical program. Changing gears a little bit to COVID, we wanted to share with you some of the numbers. In the state as a whole, we've seen a dramatic decline over the last couple of weeks in terms of our cases of COVID. The state of Louisiana is only reporting 550 new cases with 33 deaths in the last reporting period. This curve is what we've seen here at University Medical Center. At the beginning of our pandemic in March, you saw the numbers ramp up. We had a peak of about 175 patients that were admitted to our hospital in April, and that dramatically declined. The nadir was around 6 patients that were inpatient. So we've gone up to our second peak of around 40 patients or so that was in late July, but have been in the 20s, and most recently, as of today, we have 21 patients that are in-house with 18 patients on the floors, 2 patients in the medical ICU, 1 on the vent, and 1 patient in the TICU on the vent. And so this is a positive trend for us, and given the statewide decline in numbers, this is reassuring. It's an important note that we take a lot of transfers from other hospitals, and many of these patients are coming in from outside our region. In general, about 40 to 50% of the patients that we have in the second wave of COVID have been from outside of Region 1. On the next slide, we talk about some of the different testing changes that have come about. Specifically, we have 3 testing platforms here at UMC, Roche, Cepheid, and the Abbott platform. Primarily, Roche is being used for community testing, as well as high volume, large batch throughput testing. But we unfortunately encountered a nationwide shortage of Cepheid reagent, and we had temporarily transitioned our primary testing from Cepheid to the Abbott platform. We have received our first resupply of the Cepheid test, and hopefully, given the storms, we're just assessing that supply chain situation. But once that second restock supply shipment comes through, we should be back onto normal testing through Cepheid. In the meantime, please continue to order the Abbott testing, and for patients that are getting admitted, if necessary, the Cepheid test is available. Keep in mind both the Abbott and Cepheid testing platforms use different testing supplies, so that's a key distinction. I wanted to spend a few minutes talking about face shields, N95 reprocessing, and supplies in general. In general, we have stockpiled and have acquired large amounts of supplies of all isolation gear, gowns, gloves, including N95 masks. But we want to make sure that we continue to have readily available N95 masks for the time and spaces where we really need them for our patients, and to keep our staff, our physicians, and our learners safe. So we have implemented an N95 reprocessing process, and again, this is to avoid the situation of where you feel like you got to save your N95 mask and carry it around the hospital, all over the hospital. You can put it in brown paper bags that are and then place those labeled bags into carts. What will happen is that the N95 mask will be taken and treated with the UV light and sterilized, and then brought back and to the same location where you dropped it off. And so you'll be able to have a supply of N95 masks that work for you, that fit for you, and that are available for you. The N95 masks, once they have gone through processing 3 times, they're automatically discarded and then replaced with a new mask. And so we don't reprocess more than 3 times. And again, this is to ensure safety for the people that need to use the N95 masks. So keep that process in mind, and we do encourage everyone to use it to avoid, again, having to carry around these masks throughout the hospital. Regarding face shields, the more recent CDC guidelines updated in July recommended that areas with higher prevalence of COVID positivity in the community have providers use face shields as well as routine face masks when interacting with when engaged in any patient care activity. So UMC, LCMC have purchased a large supply of face shields, and you can pick up yours in the medical staff office down on the first floor in Tower 3. Come by and pick up your face shield at your convenience.
Of particular importance this week, and particularly today, is a weather update. On Monday, we watched Tropical Storm Marco make landfall near the mouth of the Mississippi, but today we're watching Hurricane Laura approach the Texas-Louisiana state line. I think it was just recently upgraded from a 3 to a Category 4, but either way, a major hurricane is expected to make landfall tonight into tomorrow. We are expecting the state to activate some of their emergency management measures and potential transfer some patients over to UMC. So the ask is to expedite as many safe patient discharges, discharging down as many as you safely can, and to work with our teams to increase capacity should our state partner hospitals need that from us. The potential impacts to our area are significantly decreased, but rain and wind and mild to moderate coastal flooding outside of the hurricane protection system may still occur today and tomorrow. So as you will, please continue to watch the local news and stay tuned to LCMC updates that will continue as needed overnight and throughout the week.
All right, this is Peter W. Just some great news. The business update about the outpatient surgery center. And so on Thursday, August 6th, UMC held a ribbon cutting for its new outpatient surgery center. The $14 million center opened August 11th. The new center covers over 17,000 square feet, is part of the University Medical Center's continued growth since opening. This is 5 years ago, since August 2015. Next in business update is East Jefferson General Hospital's acquisition. And we're excited to announce that Jefferson Parish residents officially voted in favor of bringing East Jefferson General Hospital into LCMC's Health Family of Hospitals. This vote ensures that EJ's outstanding providers and employees will continue to provide accessible, quality health care for all of our community in Jefferson Parish. While we iron out the details for expected business closing of this deal in this fall, your day-to-day activities are going to remain unchanged. It's going to be business as usual, just a little bit extra in our LCMC health team. And let's continue delivering healthcare with heart, fulfilling our deep commitment to community, patients, their families, everyone. Talking about recognition, Doctor's Day typically occurs earlier in the year, but due to COVID this year, we postponed it, and that will be this Friday, August 28th, and that's going to occur from 11:30 to 1 p.m. Invitations go out to all attending physicians, all residents, and all fellows. Please join us at the UMC Conference Center, rooms G and J, between 11:30 and 1 for an appreciation lunch and a special gift. And there'll actually be awards handed out to clinicians as well. And a big reminder, the physician engagement survey takes place, and that's September 1st. And so all attending physicians will receive a link to the physician survey. You have to be hired before July 1st and have over 500 hours of service in the system. Each link is specific to the provider, so you really can't share your email with someone else, and it is an anonymous third-party survey. The format is really a customer satisfaction survey, which looks at loyalty for the providers, and this tends to focus on both as a place to deliver care as well as a place to work. The scoring system is very interesting. So scores of 0 to 6, well, some people might think of that as average, is actually a net negative promoter score. So you would actively speak poorly about the hospital. Scores of 7 to 8, which many of us would think of as normal or good scores, are passive scores. They're people who neither promote the facility or speak poorly of the facility. And if you score at 9s or 10s, or with the terms definitely yes, then you're an active promoter. You're loyal to the hospital. This is where you would send patients, and this is where you would, again, encourage your peers to seek employment. Please take the opportunity to complete the survey. It takes no more than 15 minutes, and it gives us invaluable feedback and information that we can work with. And again, all of this goes through a third party, so all of it's anonymous. So lastly, superheroes work here. That's you guys. Looks like we've come to the end of this presentation. A sincere thank you to you guys for joining us today for this communication platform. This